Good evening. Welcome to the Pearl Report. I'm Diana Lin. While Western medicine is based on science, traditional Chinese medicine is a living legacy of more than 2,500 years of historical records, but is often dismissed as unscientific. Producer Billy Wong reports despite the dominance of Western medicine in Hong Kong, an increasing number of Western doctors see limitations in conventional treatments of chronic diseases such as cancer and painful bones and muscles, propelling efforts to integrate Western and traditional Chinese medical treatments.
Wow. 72-year-old Tang Arping has been battling stage 4 ovarian cancer for over 3 years. The tumor has spread to her neck. Her son, Chan Kim, first took her to a public hospital for chemotherapy.
The 6 sessions of chemotherapy I had didn't work well. I was losing my hair, feeling so much pain. My heart felt clogged. My appetite was gone. So I stopped the therapy.
She switched to a traditional Chinese medical doctor and took herbal medicine exclusively.
After a year of Chinese medical treatment, her health is not bad. But after all, the tumor is still festering in her ovary and another tumor growing in the lymph node of her neck. So she's still in pain.
Chinese meds can, at most, control your disease. Your tumor won't go away. But Western doctors can remove your tumor. Some diseases require Chinese Western integrative medicines.
Last year, Tang began receiving treatment from both TCM practitioner Professor Liu Yulong and Western-trained Dr. Chan Leung Cho at the Integrative Chemotherapy Center, a non-profit-making clinic in Aberdeen run by the NGO Anti-Cancer Society.
For a Western doctor, cancer is a malignant tumor, a cell growing uncontrollably and invading one's organs.
Chinese doctors see cancer as an endowment of congenital abnormality plus subsequent environmental factors, such as long-term stress, as well as attacks from external toxins. Toxins can come from air pollution and our diet.
Traditionally, cancer is mainly treated by surgery, radiotherapy, chemotherapy, and targeted therapies.
The forte of Chinese medical treatment is a holistic restoration of health. Herbal meds plus acupuncture can effectively ease the symptoms.
Tang's integrative therapy includes drinking Chinese teas brewed from around 13 types of herbs, twice a day, 6 times a week. Key ingredients include coal seeds and poria mushroom to strengthen the spleen, and dandelion and bobbed skullcap to clear away toxins.
I use this mainly to restore her health, to nourish her spleen, kidney, vitality, and blood, to improve her health gradually.
Last year, Dr. Chan gave Tang 6 sessions of radiotherapy for the tumor in her neck. Then she went to a private hospital to have the tumor in the ovary removed.
Within half a year, she had chemotherapy, radiotherapy, and surgery. The drugs and Western therapies harmed various organs and even healthy cells in my mother's body. We think the intervention of Chinese meds eased side effects such as anemia and elevated the overall effectiveness of the treatment.
But the problem is the lack of systematic and comprehensive research to compare 2 groups of patients. Is that just a placebo effect to feel better after taking Chinese meds?
Cancer, after all, is a complex disease that's difficult to cure. Early-stage patients can be cured only with surgery, but many mid- to late-stage patients have relapses and spreading of tumors. It takes more than one discipline, an integrative therapy.
Minimal integrative therapies are now offered in public hospitals at $200 per day. Tang went to private and subsidized clinics.
It costs $400,000 to $500,000 only for this Western medical treatment. The Chinese herbal meds and consultation fees cost another $4,000 or so a month.
My son saved my life, letting me see private doctors and undertake these therapies. I'm so energetic now.
TCM clinics usually have this multi-drawer storage cabinet called a 100 cabinet. Following doctor's prescription, the pharmacist will pick herbs from a specific drawer. Then they'll grind them up, boil them, or just hand the herbs over to the patients. Chinese university professor and leading orthopedist Leung Ping Chung is a vanguard in experimenting with acupuncture in his Western therapies back in 1970s.
Common conditions like back pain, after finishing the drugs, you still have patients complaining about what they had originally. So why not try traditional acupuncture?
But he said some skeptical Western-trained colleagues complained.
Acupuncture in Chinese medicine is based on tradition, based on experience, and a lot of records. So anything that is not explainable by some specific rules and the laws, that would be considered absurd and obsolete and useless. Under British rule, modern medicine is most important. What is originated from China is nothing comparable.
The handover of Hong Kong to China brought Chinese medicine into focus.
我表示確信香港有足夠嘅條件成為國際中醫藥嘅中心。
政府會盡快建立香港常用嘅中藥材嘅標準，
為中藥安全品質同埋檢測方法。
Now the rules and regulations absolutely follow what is being applied in China.
The Chinese Medicine Ordinance enacted in 1999 includes registration of traditional Chinese medical practitioners and regulations for Chinese herbal medicines. 3 universities now offer bachelor degree programs in TCM with around 100 graduates each year. Billy Fong will soon graduate from a Baptist university with a TCM bachelor degree.
I admire the philosophy of Chinese medicine. It is less invasive and it follows the rule of nature. And I was confident Chinese medicine would become the global trend.
Since 2002, the number of registered Chinese medicine practitioners in Hong Kong has risen threefold to over 6,500. 18 public hospitals include TCM clinics.
The clinics are financed by NGO. They need to look carefully at the cost. Now the Chinese medicine clinics have higher charges, so some underprivileged people may not be able to afford the service.
In the final year of a 5-year curriculum, Billy and his classmates all have to train in Guangzhou because Hong Kong is yet to have a Chinese medical hospital.
In the hospital, you can have very systematic training in different specialties.
Such as orthopedics, arguably the most sought-after specialty of TCM.
We are planning specialist training. Without the support of a hospital, it is very difficult to do.
Earlier this year, the government invited participation from NGOs to build the first Chinese medical hospital in Chang Kwan O.
Under the HA and the health department system, the consultation by Western medical practitioners are basically paid mostly by the government.
Drugs and operations are also heavily subsidized by the government in public hospitals, while medical practitioners are paid according to standard salary points. The starting wage for registered nurses is over $26,000. For Western doctors, around $60,000. Chinese doctors get around $17,000.
If Chinese medicine is included in the public healthcare system, the government has to review the present salary of Chinese medicine practitioners and create a fair atmosphere between us and other healthcare providers to attract talent into our industry.
Coming up after the break, integrating acupuncture into Western treatment of painful nervous systems. Stay with us.
Welcome back to the Pearl Report. Acupuncture is the use of needles on acupoints to stimulate the body's meridian system, restore life energy, and relieve fatigue and pain. It's arguably the most popular traditional Chinese medical therapy in the world. Producer Billy Wong talks to patients suffering chronic pain and nerve diseases to find out how acupuncture can boost the effectiveness of Western medical treatments.
2 years ago, Liu Honglong started to feel numbness in his feet and had difficulty moving around. His wife, Kuo Sui-Zhen, took care of him round the clock.
Can hardly move my feet. I wasn't paralyzed instantly. They lost strength for a bit, then I was able to walk again, limping along.
Liu consulted neurologist Alexander Lau and was diagnosed with multiple sclerosis, or MS.
It's a disease of the central nervous system. Say, if it affects the optic nerve, the patient may have blurred vision. If it affects the brain, it may affect the patient's cognition, speech problem.
As his disease progresses, Liu had all those symptoms and more.
Mr. Li has, unfortunately, a more rare form of MS, which is a primary progressive MS. We do not have a very standard or established treatment to control his disease progression.
His Western meds are mainly steroids once a day, muscle relaxants twice a day, and sedatives at night.
I'm trying my best to use medications to control his symptoms, but he's still unable to walk very properly.
He always says it's swollen and painful here and there. His buttocks feel clogged. I can't feel his pain. All I can do is massage him.
Liu was confined to a wheelchair for a year before he was invited to take part in an 8-week integrative medicine clinical trial conducted by Dr. Lau and TCM Dr. William Chung.
For the people who cannot walk, the major problem is kidney deficiency. In Chinese medicine, kidney can nourish the brain and the back and the lower limbs. 個肚有冇咩唔舒服㗎？
Besides taking Western drugs, Liu has been getting acupuncture from Dr. Chung twice weekly.
好，開始啦。遠啲啊。第二針啊。跟住第三針喺呢度啊。We put some needles on the acupoints on the limbs in order to enhance the blood circulation and nourish the limbs.
Having 8 weeks of acupuncture,
I feel more energetic. I can now get up and walk. No need for this cane. It seems I'm improving fast.
I prescribed Douzhong to Mr. Liu. It is a kind of bark to strengthen the kidney to make his limbs stronger. I also prescribed Wang Kei to enhance the body qi, which makes him more energetic.
Liu takes the Chinese herbs once a day, usually at noon, and at least 4 hours after the Western drugs to avoid herb-drug interaction.
Herb-drug interaction is the major hurdle to the use of Chinese medicine in the conventional healthcare practice. Many medicines are very effective if they are taken in the optimum dosages with stable level in the blood. But if they are interacted with other medicines, including herbal medicines, then their level may shoot up to above the therapeutic range. It may cause toxic effect.
During the integrated medical trial, Dr. Lau and Dr. Cheng monitored the toxicity of their prescriptions and sought advice from clinical toxicologists.
We have been very cautious on the use of the drugs, and so far in my program, we haven't observed very significant side effects.
Professor Justin Wu has come across patients developing hepatitis and kidney failure as a result of herb-drug interaction.
Unfortunately, so far we don't have very good systematic way to archive all these herb-drug interaction incidents, but we certainly need more studies in order to confirm this observation.
A human body has over 360 acupoints, most of which are along the meridian system. In traditional Chinese medicine, the meridian is an intangible path through which life energy or qi floats. Acupuncture is used to stimulate the meridian system and the nerve system so as to help remedy bodily discomforts and diseases. 29-year-old Marcus Gadau hails from Germany, where he first encountered Chinese medicine as a teenager. He had a basketball injury.
I totally slammed my knee. I couldn't even step on that leg, so I just kind of made my way to the acupuncturist in town, a German guy. And he acupunctured me and I walked down perfectly and drove home. And so that made quite an impression.
Finishing secondary school, he spurned an offer from a medical school in Germany and went instead to Beijing to study Chinese language and traditional Chinese medicine.
We needle the elbow, okay?
He often practices acupuncture on his fiancée, Yoko So.
The areas that I'm needling here, baby, they're called acupoints. And I'm just causing a micro-injury. And this micro-injury will cause your immune system to react.
3 years ago, Marcus came to Hong Kong to study for a doctoral degree, supervised by Professor Zhang Shiping at Baptist University. For his dissertation, he's looking at patients with lateral elbow pain or tennis elbow.
We actually found with infrared imaging, there really exist these patterns in tennis elbow, a cold pattern and a hot pattern.
Hot pattern patients have rising temperature near the elbow. It's caused by inflammation. The cold ones have no significant changes. The cause is degeneration.
And the treatment for inflammation is certainly different from the treatment for degeneration.
This shows instead of taking the pulse, TCM can also make use of technology for diagnosis.
Now, in TCM, we put a lot of emphasis on individualized treatment. Sometimes it is difficult to reproduce. Reproducibility is a hallmark of scientific methods. A Chinese medicine doctor will use all available Western diagnostic techniques to determine what disease the patient is suffering from, and then prescribe a suitable treatment.
86-year-old Chan Fengjing fell down the stairs and injured her spinal cord a decade ago. Her daughter, Elsie Feng, took her to a private hospital for spine reconstruction surgery. Then Chan had 2 years of physical therapy.
The physical therapy was very harsh for her, needed a lot of strength to pull the strings on her hands and feet. Her condition didn't improve much after the therapy, and she was confined to a wheelchair.
唉，婆婆，幾好，幾精神喎，自己佢行落嚟，慢慢嚟啦。
For 6 years, Chan had acupuncture treatments by various TCM doctors, but still needed a wheelchair. 7 months ago, she switched to Professor Lau Li Xin and gets acupuncture once a week. Chan can now walk with crutches.
She's getting improved gradually this 10 years. It's not just what I did, no miracle. I think just accumulation of treatment reached the point that her condition getting much, much better.
絕對有價值嘅，我哋付出咗咁多心機啊、時間啊，都係希望佢。
Of course, it's worth the immense effort and time we devoted. We hope she can keep up her quality of life. I'm grateful.
For the spinal cord injury, we usually select points along the spine in both sides of the back. And also the leg, because she has a very weak muscle. Usually we trigger the peripheral nerve, then the peripheral nerve will send a signal into the afferent nerve. Central nervous system will respond to the stimulation by releasing some chemicals. These can help the body recover.
Technology plays a role.
The electrical stimulator will produce the small current to stimulate the points. Electric acupuncture can help the recovery.
And Chan only needs to take Western meds for high blood pressure and diabetes.
The acupuncture actually have more synergistic effect with the Western medicine. Very often, for example, the pain condition with the inflammation, the patient will take anti-inflammatory medication. Using acupuncture together, much speed up the recovery.
Well, thank you for watching our show. It will be re-aired on Tuesday and Saturday, as well as on TVB.com. Until next time, from the Pearl Report team, good night, good luck, and good health.